Well, good afternoon. My name is Trish Strayhand. I'm with the Office of Statewide Health Planning and Development with the Healthcare Workforce Development Division. And on behalf of OSHPD, I'd like to welcome you to today's webinar on retaining your key healthcare professionals. And please be advised that this webinar will be recorded and used for future presentations, which reminds me I need to turn that on. Before we begin, I have a few things I need to go over, and as you can see on your screen, there's a few communication tools available to assist you with alerting someone that you have a comment or a question. If you do have a comment or can't hear very well, please select the raise hand icon up in the upper left-hand corner, and if you're using a Mac, the icons are actually on the right-hand side. Please remember to click the raise hand icon again once the question or comment has been addressed, and this will clear the icon that shows up next to your name. To send a note or a question or comment to me or any other participants, please use the send note icon that is to the right of the raise hand icon, and a new window will appear, and then you select the person you would like to send a note to. Please address any questions or notes regarding the presentation to the person marked Kathy Suvia Katrina Delavati. And time will be given during and at the end of the presentation for any questions received during the presentation. Please remember to keep your phone muted during the presentation to ensure that no background noise will come through and hinder the ability to hear the presenter. And you can do this by clicking on the mute icon at the top, and this will show a microphone with a line through it next to your name to let you know that you are muted. And to unmute yourself, just go ahead and click on that icon again. I will now turn you over to Brenda, and she will go ahead and introduce the speakers. Go ahead, Brenda.
Hi, my name is Brenda Mitchell, and I'm the Program Manager for the California AHEC. And it is my pleasure today to introduce our speakers for retaining your key healthcare professionals. Our speakers today are Katrina Delavati, and Katrina received her MBA in Business Administration from Cal State Chico, and she's also a certified professional in human resources. She's currently the Director of Human Resources for Shasta Community Health Center in Redding, California. Her activities include leading human resources initiatives that provide employee-oriented, high-performance culture, and she also works closely with management on recruitment, retention, and succession planning for the medical staff. Just a couple of accomplishments she has had recently. She reduced the organization turnover from 16.5% to 10% and increased staff satisfaction from 89% to 93%. And she also introduced a Values in Practice program that recognized employees and rewarded them who exceed organizational goals. Our other speaker is Kathy Suvia, and she received her MBA from Walden University in Nonprofit Management and Leadership. She is also a graduate of UC Davis Executive Development Program. She is currently the Director of Education and Workforce Services at the Health Alliance of Northern California, which is a consortium of community health centers representing FQHCs, rural health centers, and Indian health centers in 7 northeastern California counties. She also serves as the Center Director of the Northern California AHEC, and her role includes development and facilitation of programs to enhance quality and availability of primary care providers in the northern rural counties of California. Prior to her work at Health Alliance, she had a consulting firm working on leadership development within nonprofit organizations, and she also spent time working for UC Davis Center for Human Resources and provided training sessions including and focused on the topic of employee retention.
Thank you, Brenda, and thank you, Trish. This is Kathy. It is our pleasure to talk with you today about one of our favorite subjects, the value and importance of retaining your human resources. Here's an abbreviated list of the topics and ideas that we will present today. I'll introduce you to a few of the currently held theories about employee retention and some recommended applications of those theories. First, there's the ever-increasing importance of good retention strategies. That's not news to you. The psychological contract and how it can make or break the relationship with your employees. The two-factor theory of motivation, and a few of the drivers of retention and intervention strategies. And then Katrina will share with you some specific examples of how one community clinic organization has applied these theories to help them be successful. I do want to say, and Katrina and I are in agreement on this, that we don't by any means consider ourselves the ultimate authority on retention, and we certainly welcome your suggestions for your peers at the conclusion of this presentation, and hopefully we'll have some time for discussion of those. So to set the stage, just a reminder about good retention really benefits everyone. What I have found in talking to some of the clinicians over the past year is that they feel that they are carrying the burden of the increased patient load. When there's a shortage of clinicians, it doesn't mean there are fewer patients. It means that the existing clinicians treat more people. Support staff as well pick up the slack and are often asked to work outside of their comfort zone, and that often leads to a decrease in morale. Poor retention affects the organization in many ways and can result in an inability to achieve business or quality improvement goals. It can result in a loss of community image and the ability to attract other professionals, and it could lead to a disruption of doctor and patient relationships if there is a high turnover. Speaking of high turnover, certainly not the least of the effects to the organization is the high cost of turnover and replacement of clinicians, and that's estimated to be $150,000 to $300,000 depending on your location. As well, the patients don't feel that they're getting the quality of health care they deserve. There's a lack of time with the clinician, and that may negatively affect their diagnosis. Schedules are impacted, and clinicians feel that they have to rush through patients and don't have time for the in-depth kinds of conversation for finding out the medical history. But overall, it affects the community. The overall health of the community includes the physical and mental health of the residents, and that does affect the economic health of the community. So overall, global effects on everyone. Here's just a reminder that your attention to retention is always critical. This is not the time to sit on your laurels. If you feel that you have a good team, you need to constantly pay attention to their needs and work to retain them. So the first theory that I want to talk about is the psychological contract and its effect on job satisfaction and commitment to the organization. The unwritten expectations that employees and employers have with each other about the nature of their work relationship. It's the unwritten stuff, the assumptions that get us into trouble and create a lesser commitment to the organization. So some of the assumptions of the contract. The employer provides competitive compensation and benefits, career development opportunities, and hopefully flexibility to balance the needs of the employee. The employee provides continuous skill improvement and a focus on improving their professional abilities. They provide time with the organization and extra effort when needed. So while some of these items are actually specified in a written contract in most cases, they're most often not in the same manner that the employee interprets them. For example, compensation and benefits may be itemized, but it's up to the employee to determine whether or not those meet his or her assumptions of what's competitive and what's fair. And another example is the employee may feel that he or she has expended extra effort for an unexpected influx of patients, such as a flu epidemic. But that may not be interpreted by the employer as extra effort, rather what's required on the job. So you can see with these two very simple examples that discussion and conversation to identify and outline expectations is very helpful. Employee job satisfaction is a positive emotional state resulting from one's job performance, which is reflective of the individual's ability as well as the job design specifics and environment. Organizational commitment is the degree to which the employee believes in and accepts the organizational goals and the desire to remain within the organization. The bottom line is how job satisfaction influences his or her commitment to the organization, which affects directly your employee turnover. Loyal employees are more than just satisfied with their jobs. They're pleased with the relationship they have with you and the organization. Individual performance is measured by quality and quantity, as you can see from the circle on this graph. And it is affected by the individual's ability, the amount of effort he or she expends, and the organizational support that's provided. So you can see there are a lot of variables that affect an individual's performance. The second theory I want to talk about just briefly is Herzberg's two-factor theory. There are certain factors in the workplace that cause job satisfaction, we'll call them motivators, while a separate set of factors cause dissatisfaction, and Herzberg called those hygiene factors. Attitudes and their connection with workplace mental health are related to Maslow's theory of motivation and the hierarchy of needs. According to Herzberg, who took this one step further, individuals are not content with the satisfaction of lower order of needs at work, for example, minimum salary and safe working conditions, but rather individuals look for gratification of higher level psychological needs having to do with achievement, recognition, responsibility, advancement, and the nature of the work itself. Herzberg's studies appear to indicate that job characteristics related to what an individual does, the nature of the work performed, have the capacity to gratify such needs as achievement, competency, status, personal worth, and self-realization, thus making them happy and satisfied. However, the absence of such gratifying job characteristics does not appear to lead to unhappiness and dissatisfaction, so the two do not directly affect one another. Instead, dissatisfaction and the reason people leave more often results from unfavorable assessments of such job-related factors as company policies, supervision, technical problems, salary, and interpersonal relationships on the job. So it's important that we focus on those areas. The list of motivators, here are some examples. The list of motivators on the left includes things which are mostly intangible that can generally have a positive effect on motivation. The list on the right, mostly intangible items, have the ability to decrease satisfaction and performance, but fixing these may not improve motivation. Any questions so far? Okay. So moving on and talking a little bit about retention. Retention is really affected by 5 main drivers or factors. The first is the job design itself. Is there a good match? Does the person and the job do the person and the job match each other? Is it a good fit? Is there a time flexibility on the job? Is there a work and life balance component to the job? The second are career opportunities. Are training and development available? Is there mentoring provided to employees, particularly new employees? Are there career planning services? Are there advancement opportunities on the job? And something that we have found to be very desirable in talking to clinicians recently is that they really enjoy and want to have the opportunity to precept and teach others. So that's a career opportunity for them. The third driver I want to talk a little bit about is the rewards. It's not only the competitive pay and benefits, it's the link between and the relationship between performance and compensation, and the recognition. It's not necessarily a tangible reward, but the recognition for a job well done. Excuse me. The fourth driver are the employee relationships. Is there fair and non-discriminatory treatment within the facility and the organization? Do the employees feel that they have management support? Are there good coworker relationships? Especially as we all move closer to team-based care, those coworker relationships will become more and more important and certainly can break a good employee. And then lastly, the fifth driver is the characteristics of the employee themselves. What's his or her culture and values? What's his or her self-management level? And how much job security does that person truly need? Is that a good fit to the organization? So, the big question that we all want to ask is, why do people stay? What makes good retention? What we've seen through a lot of different studies, organizations that focus on this, Society for Human Resource Management is one that comes up often. People stay when they feel that they are with a good company. Do the values and culture of that organization mesh with that individual's values and culture? Is the organization well managed? Does it offer exciting challenge and growth? And then, beyond the company, is this a good job? Does the job offer the amount of freedom and autonomy that the professional feels is appropriate to their level? Does it offer exciting challenges and the patient mix that the clinician or professional is looking for? One of the things that we learned from Mark Linzer's webinars on clinician burnout was that clinicians prefer that at least 10% of their time they be allowed to focus on the patient mix or activities that they enjoy most. For instance, if the clinician has a real interest and maybe some focused learning in geriatrics, is this person allowed to work with geriatric patients at least 10% of their time? Those kinds of adjustments to the job and the spread of work within an organization can go a long way towards improving your retention. Another factor that is critically important in why people stay is the compensation and the lifestyle. The employer certainly has the ability to enhance salary and benefits within budgetary concerns. We all know those are a reality. The employee's connection to the community and the love of the area are much more difficult to affect, but not impossible. So this is, again, an important consideration in the match. When hiring, when screening and looking to hire, it's critically important to ask whether or not the region, the community, is a good match to what the employee is looking for. Oftentimes, job candidates, in their eagerness to find a job, will pretend or convince themselves that the community is one that they would be happy with. And it's important to delve a little bit further behind that and be a little bit more certain that this would be a good match. And then finally, loan repayment benefits, educational benefits, are very important and very beneficial in why people stay, at least for a period of time. In interviewing several of our National Health Service Corps loan repayment participants over the past year, they've admitted that the main reason they stay in the clinics where they are, even given the extreme workload and the less than desirable salaries, was the loan repayment benefit. The hope is certainly that given a couple of years and opportunity to put down roots in that community, that by the time that contract is over, they will feel much more connected and want to stay. I'd like to take a moment just to point out to you a couple of best practices in retention. These are two of my favorites. The first, with the Cleveland Clinic. Much has been studied about the Cleveland Clinic and their emphasis on quality of care, safety, and patient satisfaction. What's not so widely understood is that the emphasis on quality is built into the human resources policies of the clinics as well. Management and the board there appear to have a very good understanding that quality policies around staff lead to quality policies and improved care for patients. The next one of my favorite examples, is from a very small rural hospital in Mount Shasta in Northern California, a town of approximately 3,500 people. Even during the times when many healthcare organizations were struggling to meet their staffing needs, this hospital continues to have a very low turnover and a very small opening rate for employees. The hospital has implemented a variety of educational programs to develop and retain the rural workforce. The strategies include scholarships, tuition reimbursement, and a loan forgiveness program to staff at all levels, from support team members to leadership team members. Their efforts are highlighted in the YouTube video that's listed on this slide, and they truly did try some out-of-the-box strategies to meet their challenges of a rural healthcare workforce. The concept of the phases of retention often surprises people who think of retention merely as something focused on the incumbent workforce, the existing workers. However, there are actually 4 stages at which we can affect retention, and I'll talk just briefly about those. During the pre-hire phase, you should be focused on communicating clearly who you are and what you're looking for. It's all about the match. Provide realistic job previews during the recruitment process. Plan the selection process to include a person-to-job fit for all new hires. Good recruitment typically results in good retention. Where there is less than adequate attention on recruitment, retention will suffer. During the new hire phase, these are your new employees, the emphasis will be on a comprehensive orientation and mentoring, confirming their expectations, confirming your expectations, and scheduling activities with peers and community partners. It's often said that the time that an employee is most eager to please is on that first day of employment. So take advantage of that. The post-hire period, this is your current workforce, your incumbent workers. Offer a fair, competitive, and equitable compensation and benefit package as much as you can. Look for no-cost ways of compensating employees as well. Maintain a pulse on provider satisfaction and recognize your clinicians and other staff for their contributions to the organization, the community, and to their patients. Be aware of warning signs indicating that you might have a vulnerable provider, that might be personal or professional issues going on in their life. Look out for dissatisfaction or burnout. Remember the slide with the frog. Any of them could leap at any moment. And finally, an opportunity that so many miss. An opportunity that so many miss is the final phase that you have to affect your retention is the exit interview. And I know Katrina's going to talk about how her organization has implemented exit interviews and used them to their benefit. If you standardize and incorporate this step into your personnel policies, you may be able to identify issues that are not readily important, such as some of the cultural issues and the assumptions that are not clear. Maintain records on these interviews and gauge your turnover in comparison to your practice needs. Okay. So now, just a quick few words about orientation. This is a particular area of focus for me. Orientation is not simply completion of all of the required personnel forms. It's an opportunity for you to build on the relationship you began during the screening and hiring phase. It's an opportunity for you to share your history, your mission, your values, your goals, and your plans, and to share where this new person fits into those plans. It's important that new employees feel that they fit and that they have a role to play as the organization moves forward. Provide a tour and introductions to colleagues and ancillary staff. Share your unwritten rules, the norms of the organization. What's expected of the employees and what do they expect of each other, whether it is written in policies or not. Provide a connection to the community and professional organizations that are appropriate. Offer training on clinic systems and practice procedures. Offer a place to ask questions. And then review what your evaluation schedule and reward system might be. Again, I can't stress enough that many people think orientation is simply the hour where the employee goes to the HR department and signs all the paperwork. And a good orientation should probably take several weeks. Once you have your employees settled in, remember to reward and celebrate them. Career development and training, support the professional development goals of your employees, help them with CME and licensure requirements. Don't overlook the career development benefits from including providers in decision-making about the business of the practice or community relations. They really appreciate that involvement. It's empowering. Provide periodicals and journals if you can. Offer access to online resources, connections to universities. Offer flexibility whenever possible. That's such a key factor that many clinicians tell us is the need and the desire for more flexibility. Your organization events to recognize employees can be elaborate or simple homespun affairs. Both work. Some of the most effective ways of rewarding and celebrating cost virtually nothing. You can praise a job well done, specifically, directly, and quickly. This means a huge amount to an employee. Make it a point to express your confidence in their abilities. These are challenging times for all of us. Please let your staff know that you support them and that you believe in them and you believe in their ability to get through these times. Write personal notes of thanks. It just takes a minute at the end of each day to think of which employee you saw doing something outstanding or above and beyond that day and drop a note in their mailbox. And publicly recognize the people who exemplify the commitment to your shared values. Press releases in local papers, particularly in the smaller rural communities, are very easy to do and certainly cost-effective. All it costs is a little bit of your time to write it up. A point I want to make here with regard to rewarding and celebrating is that the same strategies don't always work continuously. So look outside the box. You may have to change it up periodically and try something new. All right. Any questions on the theoretical portion of retention?
I have a question. This is Virginia, and what about power in decision-making?
Yes. That's real important. Decision-making as it affects the clinical practice of an organization, but also as it affects the business operation of an organization. I think sometimes the clinical staff are consulted when there are quality or healthcare issues to be developed or improved upon or changed. But these are also individuals who are involved, who have connections in the community and might have some really good input to a business decision that needs to be made about the organization. And, you know, we all like to be included when important decisions are being made. So it's definitely empowering to include those folks. Thank you. Any other questions so far? All right. At this point, then, I'd like to bring Katrina to the microphone, and Katrina's going to share with you some of her own experiences and how these theories fit into a real-life clinic operation. Go ahead, Katrina.
All right. Good afternoon, everyone. I'm happy to be here and get to brag about Shasta Community Health Center, a place that I'm very proud of. I've been with Shasta Community Health Center for 7 years now. We were established in 1988. We're a federally qualified health center. We provide comprehensive primary care, dental, and behavioral health services. Just a little history on us. We went from under 20 employees when we started to now over 310. So we're a growing organization, including 49 providers. And I like to quote our CEO. He always says that if we're not growing, we're dying, and that definitely is the case. We've been growing since the inception in 1988. So I'm going to start off here with a quote. Our clinicians love this quote. They are very passionate about the jobs that they do, the work they do in the community. They know that they're serving a huge portion of people that otherwise would not get this health care. At Shasta Community Health Center, we've found that our clinicians are very mission-driven individuals. They want to make a difference in our patients, the underserved. This mission correlation has proven to be a determining factor in our clinician retention efforts. During the recruitment process, we take extra time into delving into kind of the clinician inner mission to see if they fall in line with our mission statement. The mission, vision, and values at Shasta Community Health Center is not something that just is on the wall. We truly live it year to year and have it in our performance evaluations. Chances are that if a clinician comes from a private practice and has negative attitudes towards the underserved, and that comes out in the recruitment process, we found that chances are they will not be successful long-term as far as a match at the health center. So we really look at the mission and how that matches with their inner mission. Little background, I'm sure you're all aware of the U.S. physician workforce shortage and where we are today. It's no secret that fewer and fewer clinicians are going into primary care. There's a 64,000 projected shortage in family practice by 2025, and then projected national shortage of 130,000 by 2025. So we are all scrambling to find those providers, and as I'm sure you are. Reports are showing that there is also an increase in clinicians seeking urgent care in hospital settings. So those in primary care, we're struggling to find those that want to do continuity and things like that we are needing in the community health center. 25% of the national physician workforce is 60 and older, so we are experiencing an aging workforce as well. So succession planning at Shasta Community Health Center is becoming more and more important as our workforce ages. This is just a graphical representation of the shortage. The physician shortage will be exacerbated by the expansion of coverage under health care reform. At Shasta Community Health Center, we are anticipating an additional 40,000 patients coming into the health center that are covered. So we are looking at expanding other satellite clinics and other areas of the Reading community, and so recruitment and retention is at the top of everyone's mind. A little bit on shortages and turnover and the effect on community health centers and organizations. Recruitment takes time. At Shasta Community Health Center, we place a huge emphasis on that team fit that Kathy spoke about. Those aligned with our mission, vision, and values, like I said before. We often have employees across job functions attend the interviews and hold them in a lunch setting. We've found that this lunch setting is more casual, and people feel free to discuss the work environment, expectations, etc. That provides that realistic job preview of how it is to work at Shasta Community Health Center. This ultimately has resulted in lower turnover because people know what is expected and what the work environment is like. Turnover results in many disruptions, as you all know, within a health center or an organization. With a patient-centered medical home, our teams break down, there's lowered access, continuity of patient care is often hindered because there's disruptions in scheduling. Support staff have to learn new medical staff's preferences and work style. So there's a huge impact across the board when there is turnover. On the other hand, low organizational and provider turnover can be a selling point when you're recruiting. Oftentimes I will tell people our turnover rate, and we will have providers that have been there 15, 20 years talk about why they have stayed so long, and it really has turned into a positive selling point when we're recruiting. Prospective employees want to know that the organization is strong both fiscally and within the tenure of employees, and this turnover rate oftentimes will show them that. Low turnover, again, indicates a stable, satisfying place to work for many individuals. Our current turnover for our clinicians is around 4%, so we're really proud of that. We have many clinicians that have actually, they have completed their National Health Service Corps contract and they've stayed with us. With healthcare reforms, Shasta Community Health Center is expecting to see, again, an additional 40,000 patients, and so our stable, effective workforce is more important than ever. So a retention strategy, it's no longer an option. It used to just be if you had a recruitment and retention strategy that was great, but it wasn't required. Now it is definitely required. 50% of all physicians leave their first practice within 3 years. So we want to look at why those people are leaving. 12 months to fill a clinician position is optimistic for most organizations. I wanted to give an example. Our psychiatrist position, when I came on board, it took us 4 years to fill that position. And we were not extremely hasty in filling that position. We wanted the right team fit. Since then, this candidate has flourished in our neuropsychiatry department and has grown the practice. He's added 2 LCSWs, an additional psychiatrist, and a psych NP. So it really paid off that we took the time to find that right fit. This provider also has taken on the medical director position for the department. And part of the recruitment process we incorporate in finding these individuals is looking for those people that like to grow, learn, teach, maybe lead a department so we can grow them along the way. Now I'm going to talk a little bit about retention strategies and how we keep people staying at Shasta Community Health Center. As Kathy mentioned, the National Health Service Corps loan repayments has been huge. We currently have over 13 providers that are using this program. Student debt is definitely on the top of their minds when they come on board. You can see the medical students' loan debts are in excess of $162. I recently hired a dentist, and his student loans were more than $400,000. So the student loan is just unbelievable, and this loan repayment really can help. We've recently considered using the state loan repayment program as well. With the recent cutbacks in the National Health Service Corps loan availability, we needed to find a backup in those cases, so we can still use that as a recruitment strategy. Flexibility in schedule is huge. We have a number of young clinician families, the Gen X and Gen Y. They value work-life balance. They have young children. They want to go to the soccer games, and they want to maintain that work-life balance. And so our staff satisfaction survey that we recently conducted revealed that flexible schedule and a work-life balance was one of the top 3 important factors across the board, not just clinicians, but people really do value that flexibility and being able to spend time with their family and so forth. Competitive compensation, variable incentive plans, and a team-based approach, those are also very important, and we use those consistently in our retention strategies. We involve the providers in the formulation of variable incentive plans, bonus structures. We have them at the table when we are restructuring these things so we can hear from them what's important and what is fair and consistent across the board. We recently held a committee of providers and finance staff to kind of update our productivity bonus, and we had a number of clinicians there. This structure took into account changes in productivity and patient complexity with our new electronic medical record system. So they really appreciated being at the table and having that ability to give feedback. Here's one of our dear providers. here with one of her scribes, and I'll go into that in a little bit. Keep a pulse on clinician development. It's really important, and what we found to be a good indicator is during the annual performance evaluation process. Part of this process, we require each provider to complete an annual career development assessment form. And this is an online form that they can complete at any time. We give them about 2 months to complete it because we know they are so busy. Questions include, what do you enjoy about your job? What do you dislike about your job? What are your responsibilities and activities? Would you like to have any additional? What's your overall satisfaction? And what would you like to get from your job emotionally and financially? Further along with this, with the succession planning, we ask them what are their goals for 2013. And the one that I find most telling is, what do you see yourself doing 5 years from now? So if we have 5 or 6 providers that are saying they're looking at retirement, we go, okay, this is time to look at the succession planning and recruitment efforts to kind of fill those spots as they come along. Residency and teaching, we have a number of clinicians that are really eager to teach. We recently added a residency program, and we have a number of key faculty, and their satisfaction actually has increased given this new opportunity. Over 90% of our providers say they enjoy doing this. It's also a pipeline for our future workforce. We're excited to have residents come on board, learn the organization, and hopefully stay with us. Providers are fiercely independent by nature, and they enjoy this opportunity to kind of have that freedom and autonomy that teaching provides. Support, support, support. We can't emphasize this enough. Giving the providers the support that they need with the demands of access, seeing complex patients that they have. The health center takes extra steps in ensuring this support to the providers. Some examples at Shasta Community Health Center is we have pain review committees, scribes, which are college-age students that actually go in and they dictate on the electronic medical record everything that's happening in the room, so the patient or the provider can really focus on the patient, and it also saves them time in the long run. We have behavioral health consultations, high-quality, competent nursing. We do a really good job of testing and making sure that these nurses are computer competent and so forth, and front office staff. And we've more than doubled our IT team since the implementation of EMR. So when their computer stops working, we have an IT person there handy so the patient flow does not stop. Communication is huge. As Shasta Community Health Center grows, we found that communication and mechanisms for consistently getting the message across is more and more important. We have an intranet that is helping us in this area where people can find instant information on the desktop. We've also found that our communication needs to be transparent and respectful. So we're really trying to get a transparent message out there, but in a respectful way. Community involvement, as Kathy said, it's very important. A lot of our clinicians and staff across the board like to be involved in our community. They see what a huge impact Shasta Community Health Center has on the community, and they in turn like to do volunteer activities. Our community involvement and the ability to participate in events is important, and we try to let them do that whenever possible. We have Give Kids a Smile, where we give free dental care to students or to children, Project Homeless Connect, etc. And lastly, balancing and scheduling and patient panel. It's important to be mindful of the provider's schedule and patient panel. Many of our providers manage extremely complex patients, and they enjoy seeing the occasional pediatric patient. They also find this is a welcome relief kind of from the strain, so we do really try to see their preferences and balance out their day. I just wanted to share with you, we did just wrap up our staff satisfaction survey for 2013, and these are actual quotes from our providers. And you can see there's a theme of support, teamwork, and culture that they enjoy here at Shasta Community Health Center, and we really do try to provide that collaborative approach. Scheduling, again, we had a dentist that was just thrilled to be able to go home and have lunch with his wife for an hour. The hours and the equipment, we try to keep nice, clean, up-to-date equipment. And again, the residency and teaching program, we're really excited to bring that on board so our providers can have that ability to teach. I wanted to also point out that there's a retention calculator link that I've listed here. The National Health Service Corps has this calculator. You can easily determine the retention rate of your providers or any of your staff. SCHC's current retention rate for our providers is 6.9 to 9.8 years. We find that pretty fantastic. And what we use this information for is we factor it into our staff satisfaction survey, which is broken down into position and tenure for responses. And then each level of tenure is looked at in regards to their responses for opportunity for improvement. And we also pay special attention to that 6 to 10 year mark where we see employees tend to be leaving and see if there's any trends that we can identify. Because sometimes you reach that 5-year point and it's where you're getting a little burnt out, you're looking for more opportunities, and so we really pay close attention to those trends. So you can access that retention calculator, and it's really easy to figure out. And I will open it up for questions now.
Any questions or ideas that any of you have found or seen that you see as a very successful strategy or a best practice that you'd like to share? Any other questions? All right. Well, then, hearing none, I believe that I want to call your attention to some of the resources that Katrina and I both use on a somewhat consistent basis. These are the things that we refer to and resources that we used in putting together this presentation as well as our day-to-day jobs. So those are all available for you on the presentation. And you have contact information for both of us. We are both available to answer questions that you might have after this webinar, and we welcome your ideas and your questions.
I also wanted to add that I'd be happy to share our recruitment and retention plan and career development questionnaire, any resource that would help you. I'd be happy to share that if you contact me through email.
You have our email addresses on this final slide to the presentation. So hearing no more questions, Trish, I believe that we are done, and we'll let you close out the session.
Well, great. I appreciate everybody attending, and have a great day.
Thank you.